For patients with back pain, major surgeries like disc fusion are often a treatment of last resort. But now an emerging technology is allowing doctors to perform those procedures with much smaller incisions, allowing for a potentially quicker recovery. Leafing through a magazine, Joyce can only dream of some of the places she used to go and things she used to do.
I love to hike from Prairie Creek Redwoods to Fern Canyon over to the Gold Bluff. It was a 13-mile hike, and I was able to do that.
But now Joyce, who asked us not to use her last name, is often in so much pain she can't get out of bed. She's hoping that an advanced surgical technique will allow doctors to fuse badly deteriorated vertebrae in her back with less recovery time.
So what we're going to do is we're going to go in the side of the spine. We're going to lift and separate the vertebrae and push the vertebrae back into anatomical alignment. And then we're going to fix it there.
But instead of an open surgery through Joyce's abdomen, Dr. Kenneth Light marks a small X on her side. In an operating room at St. Francis Hospital in San Francisco, he'll insert a tube, shown here in an animation provided by the company. Once in place, the tube expands, allowing surgical tools to reach the spine without endangering major organs.
And the advantage of it is that there is very little exposure or surgical trauma to the patient.
Picture. Okay, turn.
The technique is known as XLIF, or extreme lateral interbody fusion. X-rays help the surgeon guide the instruments. Electrodes sound an alarm if they're nearing any nerves.
Picture.
A specially designed tool cuts and removes disc material between the two vertebrae. Again, using the X-ray, Dr. Light then places a spacer to align the vertebrae.
All right, go back to the AP view. So now we know whether the implant's going to fit properly. It's in the middle.
Once the bones fuse together, they'll stay in position, hopefully relieving irritation on surrounding nerves. Because of the limited trauma during surgery, patients typically recover several weeks faster than traditional methods. John Diebold had the XLIF procedure last fall. He says he was able to begin walking in his Oakland neighborhood the following week.
I had a brace on, and I got tired easily. But as far as pain, I didn't have much pain at all.
The surgical tools and the tube itself are ultimately removed through the same 1.5-inch incision, leaving the fused bones to heal and hopefully allowing Joyce to live pain-free.
To be able to hike that 13-mile hike back to Fern Canyon from Prairie Creek, I think that, because the redwoods are so beautiful, I love to do that.
And while the recovery times are typically faster, the cost of the procedure is still similar to open chest methods because of the monitoring and technology involved in the operating room. And the procedure, by the way, is covered by most insurance.